Thank you for joining us this hour. Another hour on the Edge has flown by. We have been talking this hour about cardiology, especially different techniques in cardiology. With me from San Antonio, Texas, Dr. Janet Hayes. From Hawaii, Dr. Joan Flanders, and they are in town for the American College of Cardiology Convention, and were kind enough to join me. I do want to pick up on the thread. We had spoken before about invasive versus non-invasive, and so the interventional versus non-interventional. And I did want to make sure that we cover the bases on that before we close the show. There's so much to talk about. Yes. But you started to talk about, in fact, someone we know had a radio ablation, and what is these in these invasive procedures? What's the success rate? Are these commonplace now, or what are these interventional activities? Are these widely used?
Yes, and you are there are really two fields of interventional, and that's really electrophysiology, which that's just exploding. All the ways they can get at and map various areas of the heart for their electrical activity and find the areas that are abnormal and then ablate them in some way, versus working with the coronary anatomy, doing stents, angioplasties, and then working with valves. There's a lot of cath lab procedures now to fix valves that were once only done by surgeons, and it's expanding into the vascular tree, crossing over, sharing the territory somewhat with vascular surgery and with interventional radiology and the carotid arteries, and so those are two very distinct fields. There's the interventionalists that are the cath lab-based coronary interventionalists, and then there's the electrophysiologists who work purely with heart rhythm problems. All right. So very different things.
So, and are both of you doing invasive procedures?
I'm doing cardiac catheterizations, standard diagnostic cardiac catheterizations, and I used to do some angioplasty. I don't anymore. I've never done electrophysiology per se. Joan does pacemakers.
I do pacemakers and diagnostic caths, but not angioplasty.
Mm-hmm. And is there a trend toward invasive or non-invasive procedures?
Well, obviously you can't fix certain things without doing invasive things. And as surgery, obviously it's not as desirable to have your chest cracked open to have something fixed as it is to do it through a pinhole catheter. So that even now they're talking about closing atrial septal defects and maybe even ventricular septal defects non-surgically or through the catheter. So the catheter-based interventions I think are here to stay. I definitely think they're here to stay. And really I think it's individual cardiologists' personal preference whether they are invasive, non-invasive, interventional, non-interventional, or electro-interventional.
Okay. Joan, I wanted to specifically ask you, you had mentioned to me before the program that while the North Hawaii Community Hospital is an allopathic hospital, you're also involved in some, naturopathic would be an accurate description?
We actually call it blended medicine.
Blended medicine. Can you tell me a little bit about that? I'm very curious.
I would be delighted to, because it's I feel very exciting, and one of the reasons that I took the position that I took at a traditional Western medicine hospital that embraces blended medicine. For example, in my hospital, if I have a patient that is having post-surgical pain or nausea and I want to order acupuncture, there are acupuncturists on staff that I can order that as a therapy for the patient. We also have many things that patients can kind of self-order, guided imagery and meditation, technology called HeartMath, which is like a biofeedback class or tool patients can self-refer to. We also have aromatherapy and pet therapy, which is getting to be very popular in other hospitals. But it's the only hospital of its kind that actually is a JCO certified hospital that also has a full concert of all the other so-called Eastern type medicines at our disposal.
And of course, I feel obliged to ask you if there are any extant clinical studies that have been published that demonstrate the efficacy of these.
There have been a lot of studies on guided imagery, for example, in surgery. Patients who are taught guided imagery prior to their surgical procedure use far less pain medications, have longer or shorter lengths of stay, and just report kind of a better healing. The time to healing, obviously, at the tissue level isn't any different, but the patient perceives that they are back to work faster, etc. So that's been pretty well established. Acupuncture has been studied mostly in China. Not a lot of randomized placebo-controlled studies in the United States, but it has been studied more or less. A lot of herbal medicine is not validated, but some has been studied. So it's kind of it depends on the technology or the alternative therapy that you're talking about. But in my mind, I would never abandon Western medicine. I would never tell somebody that they need to have their gallbladder out by psychic surgery.
Okay.
But I think that it's very nice to be able to use things like acupuncture and meditation, I love in heart disease, because the agitated sort of type A patients do so much better when you teach them some of the tools to non-pharmacologically calm themselves down.
Sure. Well, suffice to say that we have much more that we could discuss today, and perhaps we will be able to arrange a future, if you're not able to come back to the studio, perhaps we can arrange something that would be done long distance, and we have the technology for that. Dr. Janet Hayes, thank you so much. Dr. Joan Flanders, thank you so much. You have been watching In Time TV's On the Edge. This hour we have been talking about cardiology and procedures and the types of cardiological specialization that's going on now. You can join us on a regular basis at www.intimetv.com. You can always join the conversation by sending an email to ask@intimetv.com. That's ask@intimetv.com. I also have a blog site that is www.jonasmoses.blogspot.com. For In Time TV, I'm Dr. Jonas Moses, On the Edge.